Hello, hi there, I'm Dr. Shariful Halim, and today I will show you how to examine the motor part of the nervous system in the lower limbs. So I have already introduced myself and taken the consent from the patient and exposed properly, as you have seen. So before examining, you have to understand what are the things that you have to see. So we have to see actually 9 things in examination, and I have a mnemonic for it. This is BTP, BTP, JCC, and GRS. B for bulk, T for tone, P for power. J for jerk, C for clonus, and another C for coordination. G for gauge, R for Romberg sign, and S for spine. So let's see. So first we start with bulk, and we actually expose well and see the muscle mass in both of the limbs, the thigh, also the legs, and then actually measure it by a measuring tape. So we have a measuring tape here, and we take a specific point from here, from tibial tuberosity, suppose 10 centimeter, and then measure it. Measure it, and do that for this leg also, and compare it. And again, we have to measure the thigh. Suppose we take 15 centimeter from here and measure it. Measure it, and after measuring, we have to compare that with that limb. Okay. Next, we have to see the tone, bulk, and then tone. So for tone, the best method is passive movement of the joints. আপনি আপনার পাটাকে নরম করে রাখেন তো একদম, ঠিক আছে, একদম নরম নরম মানে ছেড়ে দেন, একদম ছেড়ে দেন. So passive movements of joints, ankle, then knee and hip. So both joints can move together. Okay, and we'll do that for this limb also. Okay, next, we can also see the tone in other methods, like we can actually pull the patient's limb and then tell him to let it fall. Tell them, very good, and do it for this also, same. And also we can roll the patient's limb, and actually what I'm doing here, we're actually seeing the movement of these joints, hip joints, and the muscles surrounding it. Okay, so if the muscles are taut here, you can do that. So we are seeing the tones in that several ways. Next, power. So to see the power, first we have to tell the patient to lift his leg with the knee joint extended. আপনার পাটা ভাঁজ না করে আপনি পাটা উপর দিয়ে তুলেন. Very good. So we give him 3 out of 5. এখন আমি আপনার হাত দিব, আমার হাত সহ আপনি উপরে তুলবেন, ঠিক আছে? তোলার চেষ্টা করেন. Very good. 5 out of 5. And we'll do that for that limb also and compare. Next, we have to see the jerks. Now we start with the knee jerk. পাটাকে একদম নরম করেন, একদম নরম, হ্যাঁ, ছেড়ে দেন আমার হাতে, আমার হাতের উপর একদম ছেড়ে দেন, হ্যাঁ, ঠিক আছে? We are palpating the tendon, patellar tendon, and then we're looking at the muscle, which quadriceps muscle. Okay, we see the jerk, and this will be again done in the other limb. I'm not doing it for. And now we have to see the ankle jerk. পাটা একদম নরম করে ফেলেন, হ্যাঁ, ছেড়ে দেন. So we have to see the ankle jerk. Okay, you've seen that? Nice ankle jerk. Next, we have to see the plantar response, and to see that, we have to take out our. Please come here. Take out our key and actually fix the joint with this hand. Well, I'm fixing the ankle joint, and then I'm moving the key from here to here. So I'm moving the key from here to here. So, okay, please, very good. So this patient doesn't have that much of a feeling. Next, we have to see for coordination and clonus. So to see for clonus, পাটা একদম নরম করে ফেলেন, হ্যাঁ. There is no clonus in the ankle. নরম রাখেন পাটা একদম, এই মাংসগুলো একদম নরম করে রাখেন, ঠিক আছে? No knee clonus. Next, coordination. আপনার পায়ের যে গোড়ালিটা আছে, এই গোড়ালিতে এখানে হলো আপনি ঘষা দিবেন, ঠিক আছে? ঘষা দেন, ঘষা দেন. Very good. আবার এটাতে এখানে ঘষা দেন. Very good, সুন্দর. Okay. Next, we have 3 other parts: gauge, Romberg, and spine. So let's first just see the spine. আপনি বাপ ওইদিকে আসুন তো. So we have to actually look for any gibbous or any tenderness in the spine. Okay, so look for them. Okay, next we have to see the gait and Romberg sign. আপনি একটু দাঁড়ান ভাইয়া, দাঁড়ায়া আপনি আমার দিকে তাকান। হ্যাঁ, এখন আপনি চোখ বন্ধ করেন, আমি যখন বলবো তখন আপনি চোখ বন্ধ করবেন, ঠিক আছে? ওকে, চোখ বন্ধ করার পর আপনার মাথা ঘুরতেছে কিনা বা পড়ে যাচ্ছে কিনা আমি সেটা দেখবো। ওকে, so we have to ask the patient to close his eyes and actually আপনার পাগল এরকম করেন, keep his feet together and then we have to tell him close your eyes, চোখ বন্ধ করেন, and we have to look for আবার চোখ খোলেন, we have to look for if the patient just moves in this way. So if the patient gets ataxic or falls, so this will be due to dorsal columnation. So this will be a positive Romberg sign in case of dorsal columnation. And then we have to see the patient's gait. আপনি একটু হাঁটবেন এখন, ঠিক আছে? আপনি এখন হেঁটে ওই পর্যন্ত জানতো, ওই পর্যন্ত গিয়ে আবার ঘুরে আসেন এখানে, যান, ভেরি গুড, আবার আসেন, সুন্দর। So this is the basic gait and we can also see some other gaits such as আপনি দেখেন এরকম করে যাবেন এখন, একটা পা দিয়ে তারপর তার সামনে এভাবে। Okay, so this is another method of gait examination. It's actually the function of cerebellum, and that's all. There are some other methods by what you can see the gaits, but I think that's all should be the basic parts. Okay, so those are the most important parts of the nervous system, motor examination of the nervous system. And thanks to our patient for being very cooperative, and thank you. Okay, and tata.